Lesson 1. Introduction to Health and Peace. Introduction. Conflict affects health in many ways, including the disruption of health systems and the collapse of medical supply chains, the exodus of healthcare personnel, and the spread of epidemics. Conversely, according to the Ottawa Charter for Health Promotion of 1986, peace promotes and is a key prerequisite for health. Similarly, health has a significant impact on conflict, with many drivers of conflict being health-related. A good example would be inequitable access to healthcare, which can and very often does fuel resentment and discord. Health is a superordinate goal that can bring people to work together to create a safer and better world for all. These linkages between health and peace shape the place of the World Health Organization within the global responsibility to contribute to peace building. Health has the power to transform an individual's life, but it also has the power to transform families, communities, and nations. Definitions of health and peace. These are three of the most utilized definitions of health and peace. Health is a bridge for peace, developed by WHO as a framework supporting healthcare personnel in delivering health programs in conflict and post-conflict situations, as well as contributing to peace building. Peace through health emphasizes the role of health in enhancing both peace and health through actions in both the health system and the war system. Health diplomacy. Health as a neutral basis for improving diplomatic relations. Health as a bridge for peace. HBP. In 1948, the Constitution of the World Health Organization stated that the health of all people is fundamental to the attainment of peace and security. The absence of peace has devastating effects on human health, directly with injuries from fighting and indirectly from the breakdown of health services. When conflict rages on, healthcare is increasingly under attack. Each year, hundreds of confirmed attacks on healthcare take place in emergency-affected countries and fragile settings. There are many real-life examples of health as a bridge for peace. For example, in the mid-1980s, the United Nations Children's Fund, UNICEF, the Roman Catholic Church, and other organizations negotiated 3 days of tranquility in El Salvador. Fighting was suspended for the immunization of children for 3 days each year from 1985 until the peace accords in 1992. Similarly, between 1996 and 1997, WHO facilitated negotiations between the Croatian Ministry of Health and Eastern Slavonia Serb leaders on public health issues and facilitated cross-community contacts through joint health workshops and seminars. Peace Through Health, PTH. Launched in the mid-1990s, the McMaster PTH framework views war as a disease that harms people at the individual as well as the population level. The model offers interventions that target each stage of war. Primary intervention aims to address the root causes of conflict before the outbreak of violence. Secondary prevention, a situation where war has already broken out and efforts are being made to minimize destruction and pursue resolution. Tertiary prevention applies to action to promote peace by rehabilitating war victims. The Peace Through Health framework encourages involving different levels of society through implementing multi-track interventions for peace. 10 mechanisms are identified to form a distinctive health track. 1. Health-related superordinate goals. 2. Evocation of altruism. 3. Dissemination of accurate facts. 4. Redefinition of the situation. 5. Trauma healing. 6. Building civic identity. 7. Contributing to human security. 8. Diplomacy mediation. 9. Solidarity with victims. 10. Non-cooperation in conflict drivers. Health diplomacy. Health diplomacy is when countries and organizations use health as a way to build better relationships and solve problems together. It means using health issues as a reason to talk, cooperate, and make peace. Health diplomacy brings together experts from different areas, such as from politics, medicine, and law, to work on shared goals. For example, During the COVID-19 pandemic, countries had to work together to share information, vaccines, and resources. They faced challenges such as socioeconomic and gender inequality and an unfair distribution of help. The pandemic showed how important it is to have strong international cooperation in health. Health diplomacy helps countries agree on rules they will all follow, share knowledge, and support each other during health emergencies. Working in conflict or working on conflict? There are two main ways to understand health work in conflict situations. Working in conflict. Implementing interventions that mitigate the impact of conflict on people's well-being, preventing further health consequences, and supporting health systems and service delivery in conflict-prone regions. These include life-saving humanitarian actions, as well as interventions targeting development goals that need to be sustained in spite of an ongoing conflict. Working on conflict. Designing health projects to address conflict drivers and/or fostering cooperation of opposed groups on health issues in a peace-responsive manner. Case studies. Somalia. In Somalia, the United Nations delivered mental health care and psychosocial support to youth. This aimed to reduce stigmatization and marginalization and help them become positive agents for social cohesion. Sudan. In Sudan, WHO mobilized at-risk youth in Khartoum and Central Darfur to clean marketplaces and hospital surroundings, removing environmental health threats and protecting youth from violence. Tunisia. After the 2011 revolution, societal dialogue for health system reform facilitated citizen participation in public processes, allowing previously antagonistic groups to cooperate for the common good. Syrian Arab Republic. 6 years into the Syrian crisis, mental health needs among Syrians exposed to violent conflict and loss have increased. However, access to mental health care for people in need remains a challenge. WHO and partners have increased the availability of mental health services across the country.